So in addition to the 3 modalities that you're already working with, you also incorporate nutrition in your practice. Now, nutrition is the basics we all have to deal with. We all have to eat. So in what ways does nutrition play a role in your practice?
Well, nutrition is kind of the foundation. For me, it's the foundation of health. That with nutrition, you can create the conditions for health to exist in the body. Food is extremely powerful. Food itself can both create diseases and it can also take that predisposition and dramatically remove that person from that disease state to a more healthy state.
Right, okay.
So, and when I talk about nutrition too, it's not so much supplements. For me, it's much more important to talk about whole food. And whole food is, you know, when we talk about whole food today, people look at it as being health food. I look at whole food. Whole food is basically what my grandparents and great-grandparents ate.
Right.
You know, when we talk about having, say, roast beef dinner with vegetables, well, now we have to talk about, is it grass-fed? Is it organic? Or is it just regular, you know, feedlot meats?
Right.
And so, for me, when I'm talking about whole food, I'm talking about, you know, beef that was grass-fed. That's what cows are supposed to be eating is grass. And so, and now we have to talk about fruits and vegetables. Are the GMO genetically modified or not genetically modified? So again, it's going back to the basic, going back to the foundation of what health, what food is ideal for us for centuries, for thousands of years. And that's the type of food that I like to put people on.
Right, right. I know, just even walking around the grocery store for 3 weeks, I was off 7 things, like the starch, the corn, and it was really limited to what I can have. Pretty much, like they say, you walk around the perimeter, and then everything in the middle is no-go.
A lot of the foods in the middle of the grocery stores were not ever present. 60% of them weren't present 70, 80 years ago.
Right.
It's a whole new, you know, this new food technology is not necessarily mean it's good or healthy for us. You know, back in 1961, there was an American physiologist that appeared in Time magazine, and he was a physiologist and marine biologist, and he came up with this theory called the fat hypothesis or lipid hypothesis. And what he basically said was that saturated fat causes cardiovascular disease. And it wasn't until 1977, I believe, that the McGovern report from the US Senate came out and said, we strongly recommend that people decrease red meats, increase grains, and eat more fruits and vegetables. Well, since 1977, since people started taking that advice and all the products out there are low-fat products, what's happened is we have now an epidemic of obesity, diabetes. We're getting children coming in with at a younger age developing diabetes, elevated blood lipids. We've created a paradigm by which, rather than getting healthier, we're getting sicker. And it's based on a hypothesis that was never proved. Now we know that saturated fat, in fact, does not cause cardiovascular disease. You can eat eggs. You could eat 2, 3 eggs a day, and I guarantee your cholesterol levels will not elevate. It has nothing absolutely to do with it. Carbohydrates are the main triggers for increasing your blood lipids, for elevating cholesterol, for increasing cardiovascular disease. Even carbohydrates are even related to things like such as Alzheimer's, which is now known as the diabetes of the brain. So it's really important that there's so many myths out there in terms of nutrition. We've got to start making dramatic changes and start breaking those myths, because, you know, I'll have patients coming in that have seen cardiologists and they've said, no, cut out your red meats and cut out your eggs. And I'm looking and saying, well, you know, there's no evidence, scientific evidence, indicating that by reducing those aspects will actually have any effect on cholesterol. And by reducing the carbohydrates, you get a dramatic decrease in your in blood lipids, in serum cholesterol levels, uric acid levels will drop. So it's far more important to what I call address the real underlying problems in terms of our diet, rather than these perpetuate an ongoing myth that you know, both corporations and other professions have been perpetuating.
Okay. Now, in terms of carbs, are you thinking all carbs or just certain carbs?
Depends on what state of health the person is.
Right.
If you have a patient, say for instance, that is on very high levels of metformin and glyburide, and their blood sugar is very, very elevated, it's almost like a pendulum. That if their blood sugar is very much elevated out of here, you have to do an equal amount of decreasing carbohydrates in order to bring it down. Mm-hmm. So if a person is I take them off all carbohydrates in terms of grains. I will still have them on some carbohydrates. They will get some from vegetables.
Right.
But the amount of grains that I will basically put them on a no-grain diet, because what you'll notice is not only will the blood sugar drop down very quickly, but also if they have weight issues, their weight loss will start taking place as well. So they're still having meats, fish, fruits, vegetables, but some of the fruits, of course, will be more not the tropical fruits, but maybe more the berries and perhaps some apples, peaches, plums. We'll have them still on some fruits, but totally off the grains.
Darn it.
Yep, well, but again, it comes back, if a person has just slightly elevated blood sugar, you have to do less. It just depends on where the person is and at what point they're coming to see you, and to what degree you have to see a change take place. The greater the change, the more you have to do.
Oh, that's a good thing I juice once a week, huh? Now, do you often treat people with nutrition and nothing else, or do you usually combine?
I usually combine, but it depends. If someone comes in and they have, predominantly it's say for instance diabetes, for example, the forefront will be nutrition, the background will be perhaps homeopathic medicine or something else, depending on if they have some other side issues. But if the person comes in with diabetes, but they have a lot of other complications as a result of it, or other problems like sleep disorders or skin problems, whatever, then it might be 50-50. So it just depends. You have to sort of arrange it according to what's presented in front of you.
Right. That's good that you customize it like that.
It's got to be customized.
Not all fit in one box. Now, how does nutrition play a role in homeopathy and vice versa?
Homeopathy is kind of I kind of look at homeopathy is it takes care of the conditions that have evolved. Say if a person comes in and they have, say, migraine headaches, they have eczema, they have, say, some bowel problems, the homeopathic medicine will, in a sense, be able to change the expression of those problems. In other words, if a person has migraine headaches and you treat with homeopathic medicine, the homeopathic medicine will be able to start reducing those migraine headaches, becoming less and less frequent to the point where they're resolved. Same thing with the skin conditions, and etc. The nutritional part comes in, and like I said, it creates the conditions for health to exist, and in some cases, some of those foods may be contributing factors to triggering a migraine or triggering the skin condition. So they work hand in hand together. So I really don't see how you can treat a person without using nutrition as a foundation.
Right, exactly.
Almost every single person, I don't think there's a single person that doesn't come into my office that we don't talk about nutrition. To me, it's a foundation. It's what nourishes a body. It's what keeps us healthy. It's just like exercise, drinking plenty of fluids, and food. Those are the foundations of health.
How often have you come across a case where nutrition completely just took over and and
it was only nutrition?
Yeah.
That's really hard to say. I can think of a few times, yes, I can think of a few times where people have come in and they are quite healthy and they just want to know what they can do to increase their health. So in those cases there, we've sat down and discussed what they're eating and made some alterations, and that's all that was necessary. Yeah.
Okay.
Majority of my practice, though, tends to be more people who come in with more serious disorders. that's where the majority of my practice. But yes, I have had some people that have said, you know, I'm healthy now. I just want to maintain that and prevent things from down the road.
Okay.
Yep.
Thank you so much for that information.
Okay.
And hopefully this video gets in the hands of one person that can be helped. Thank you.
You're welcome.